our Healthy People 2020 assignment, our topic was preparedness. The goal of this topic is to strengthen and sustain communities' abilities to prevent, protect against, mitigate the effects of, respond to, and recover from incidences with negative health effects. If this goal is achieved, children as well as adults will be given the opportunity and the resources to be protected against any crisis that could affect their health, whether infectious disease, natural disaster, or etc. If this goal is failed, it will leave those individuals in charge, or in worst case scenario, without the proper preparedness. There is no one set in leading positions in order to accompany this issue, and things are left in an uproar. If the situations aren't prepared for ahead of time, actions may be off impulse and important things may be left out. Things may not get done properly, or even if they can act upon impulse, they won't know what to do if they haven't prepared for whatever else is knowing nothing about the crisis.
So Louisiana has a plan. It's called the Prepared Health Emergency Plan, and basically it helps with anything like whenever we have the flooding, anything like that. Everyone can work together and we can help save people sooner. But the one thing that I'd like to point out is, so Louisiana, our funding for this plan is $9 million, and then whenever you compare it to Texas, who's just right next door to us, it's $37.9 million. So although we do a good job at helping people in a crisis, our funding isn't as much as some of the other states they have available.
Okay, so I am going to present you with Objective 2. It talks about reducing the time necessary to activate designated personnel in response to a public health emergency. The target is actually 59 minutes, but the baseline reach is in 66 minutes for an immediate report to duty with no response time or advance notice about this emergency. So some risks associated with that. When there is a large-scale emergency and a sudden occurrence of these events, there may not be enough supplies or a prompt time for these personnel to be notified. So the CDC actually has a national medical stockpile available that actually allocates these services. So compared to other states and outcomes, this was a measure not just based on Louisiana or specific state, but it was represented by all 50 states. And the emergency support function number 8 is really what kind of designates all these supplies and services. Immediate medical response capabilities are provided by the assets of the Health and Human Services. So they really go out and they task each component of civil service, offices of public health, and the regional offices and people of the state to engage civil volunteers and requests to the VA and the DOD to provide available personnel to support pre-hospital triage and treatment, inpatient hospital care, outpatient services, pharmacy services for these people who are seeking any kind of help needed when this disaster or occurrence happens.
My goal was number 4. The goal was to reduce the time for state public health agencies to establish after-action reports and implementation plans following responses to public health emergencies or exercises. The target for this objective was 41 days, but the baseline is 46 days, and all states are required to send in their information after a public emergency, or if they're just doing exercises to prepare for a public emergency has occurred. This information was obtained from the CDC and the Division of State and Local Readiness.
Mine is going to be the 5.1 area of preparedness. So mine is about family reunification plans. So a lot of times when we focus on the plans of disasters and preparing, we're always focusing on what are we going to do in a disaster, but we never remember or know or even think about what we're going to do whenever we are reunited with children, family, aunts, uncles, and grandparents. So that's what I'm going to talk about. This is the goal of increasing the percentage of school districts that require schools to include family reunification plans. Children make up 1/4 of the United States population, and they have unique physiological and psychological needs, which increase their risk during disasters. Children with disabilities, children need cribs, they need diapers, formula. Children who can't have cow's milk need almond milk. You need pediatric supplies. These are all things to think about. So on a national level, which is all 50 states, shown in 2012, according to CDC and Healthy People 2020, our baseline in the United States is 67.8, while our target goal is 74.6. So obviously we're lower than that. So a lot of the data was collected with computer-assisted telephone interviews and 23 self-administered questionnaires by personnel per state. So there are things that affect the outcomes of these goals, and there are 8 outcomes with this particular one. So the first one is health education, then you have physical education and activity, health services, nutrition services, mental health and social services, health and safe environments, faculty and staff help, and family and community involvement. Now, the majority of the states do have preparedness plans, and of those majority, Texas has a plan while Louisiana does not have any plans. They're still in the process of making those plans for reunification of children and families together. Because of that, it also makes it harder with children because they're afraid to provide information. They don't know who to trust and what information to give and not to give. In Texas, since they do have a plan considering in relation to Louisiana, some of the things they look at is focusing on the child and not only on the family or how long it's going to take for them to achieve the goal to reunite with their family, or how long or how fast they're going to achieve that goal. And also, parents with alienating behaviors make it more difficult for the child to reunite with the family, such as if the parent is not very loving, if they don't hug their child or kiss their child or share that care for that child, it makes it harder for them to do that. So those are some things that Texas looks at, and our big purpose is to reunite children with family and provide the services to support long-term stability and prevent replacement and further disasters in our future.
So mine is next, and it was 5.4, and that objective was to increase the percentage of school districts that require schools to include specific provisions for mental health services for students, faculty, and staff after a crisis has occurred. So on a national level, the target was 76.2%, but the baseline was 69.3% of school districts. And this was after it occurred in 2012. So data for the objectives that you choose, there were no disparities that specifically exist for this, but in order to approve the numbers and reach the target goal, we have to make sure that the school districts and specific schools know about this and that they're willing to cooperate to achieve this goal. So we must first make sure that they know what mental health services are available, and whether in that city or remotely even close to that city, where they can still utilize their services easily and make a great impact on not just the school but the community. So as the school goers become involved, then they tell their families, and then they tell their friends, and then awareness just spreads like wildfire, so it's like a chain reaction. So this, in comparing the states with Louisiana, the Healthy People 2020 website had a disclaimer that not all state and territory plans would be available for this topic, so we weren't able to see exactly Louisiana's specific numbers in order for us to compare those goals. So we had, on a national level, the entire United States, all 50 states as the geographical location that was specified. But what I did find, there was Louisiana and New Mexico and Texas. Those positions were vacant for a state and territory coordinator. So maybe that was a factor for the stat numbers, why they didn't give specific numbers, or why we didn't have anything to compare to. And also on the Healthy People 2020 website, our topic, preparedness, was one of the newer topics. So maybe they didn't have a chance yet to actually have those numbers available for us to use. So the coordinator, they ensure that the development of a state or territory plan is in line with Healthy People goals and objectives. So that should be something getting together or getting a representative for the state. So the factors that impact achieving the goal, not knowing what resources are available, like I said at first. Like one specific is creative counseling. That is a privately owned counseling business that attends to the mental health needs of children children and adults, and it starts from ages 5 on up. And they have a licensed psychiatrist that comes once a month and does medical evaluations on the clients, with the owner being a national certified counselor. So although their office is located here in Shreveport, they service areas around us like Coshada, Natchitoches, other locations. So that could be something that could help others. And so if they know that these are available, that could be something to help. So another impact would be having the service workers available. So they distribute workers that go out to these different locations and see to the needs of these children and adults. So that should be something that they could be aware of so that they could know how to fix it.
So the final objective is objective number 7. So the goal of this objective is to increase the proportion of adults residing with children attending school who have an emergency plan in place and have household discussions about that emergency plan. So basically, preparedness, it requires coordination throughout the entire community. The most effective and least expensive way to protect Americans from health threats and disasters is to stop them before they spread. Basically, just don't let your guard down. So the target for this is 89.5%, but our baseline is 79.2%. Some of the disparities that come with this objective is gender. So in 2011, 81% of males reported that they did have a preparedness plan and they actually discussed that with their children, while 77.7% of the females reported that. In 2012, the males actually decreased to 74.5%, while the females increased to 79%. Another disparity is race. So in 2011, actually in both 2011 and 2012, African Americans were the highest at having a preparedness plan and discussing that with their children, and Hispanics or Latinos were the lowest in both. So African Americans in 2011, they had 89.7%, Caucasians had 79.9%, and Hispanics or Latinos were 66.4%. In 2012, African Americans were 85.4%, Caucasian were 79.9%, they stayed the same, and Hispanics were 57.8%. And just in 2012, that was a 27.6% difference between the best and the worst. Another disparity is education. So whenever you compare 2011 and 2012, it's clear that people with advanced degrees tend to have the preparedness plans and communicate that with their children and help plan that with their children more than people with only associate's degrees. In 2011, the advanced degree was 89.4%, and then it went down to some college, which was 81%, and then high school or GED was 77.9%, four-year college was 75.2%, and associates was 68.2%. In the 2012, the advanced degree was 84.2%, some college was 82%, high school or GED was 80.4%, four-year college was 77.2%, and associates was 75.6%. And luckily it did drop, the difference did drop. In 2011, the difference was 21.2% between the best and the worst. In 2012, it dropped down to 8.7% difference. The last disparity is disability. So in both 2011, 2012, it's shown that people with activity limitations have an increased report number than those without the activity limitations. In 2011, people with activity limitations, it was 83.9, and without was 77.8. In 2012, the with activity limitations was 78.7, and without was 59.8. So that actually dropped. I think the main thing to look at with the disparities is the difference in race, because it's always the Hispanic and the Latinos that have the lower report rate, and that might be communication barriers. That might be, what if their children, what if they don't work or anything, what if they're not actually getting out in the community and communicating with everyone on the necessary needs for a preparedness plan. How this data was collected, so they did not collect it with a specific population, it was overall, and they used computer-assisted phone interviewing systems. People who spoke Spanish were provided with Spanish-speaking respondents. This was conducted between June and August of 2012, and it excluded people who were in a prison or jail, a mental facility, people who lived in dorms, barracks, and boarding houses.